we're here. Oh, everyone's talking in the comments already. Hello, thank you for being here. I was gonna do this whole like, hello, welcome, because I'm using my gamer chair today. Thank you all for being here. We're gonna talk some teeth today. I have my Invisalign in, but hopefully you'll still be able to understand me. And I'll be checking out the comments. We have some comments already. This is so exciting. I saw someone, yes, we're going to be doing a toothy Q&A. So thank you so much for being here. My name is Whitney. I'm a dental hygienist. Today we are live streaming and we'll be live streaming a Q&A, a question and answer. So ask me questions and I'll answer to the best of my ability, toothy topics about dental health, about dental hygiene in general, or the dental hygiene career, or any questions about my life as a dental hygienist, or in general, or whatever you are thinking, if you have questions. Of course, I can't give out any individual medical advice. However, hopefully I will help give you some generalized answers to help you have a better idea as to what you should ask your dentist and or your dental hygienist at your next appointment, right? And things to look out for, tips and tricks to use at home. So I already am seeing some questions, so let's jump right in. If you missed the beginning of this, you can also watch it later. It will be posted on YouTube later as well. Oh, one random thing. So my hair's cut. As you can see, it's huge because it's like very humid in Chicagoland right now. I love the humidity though. Anyone else? Where's everyone out at, by the way? I love knowing where everyone's in the world. So let me know your location. I love that if you want to share. Or if it is or isn't humid wherever you are. So when I first used to do these lives, I always used to do them when I was on vacation. Random. It was like a vacation thing. Like, I'm on vacation here. I just love different areas and locations. And then I would do a live and talk with you all. Anyway, I used to always do this like really big, deep side part. And I haven't done that in years. So I'm like, I'm going to do it today now that my hair's cut. Okay, so here we go. The first question I am seeing. I'm also a CRDH, but one topic I always get asked, this is Denise. She asked about if patients ask you if oil pulling works. I don't know how to answer their question, just that there's not enough research about it yet to determine it. So Denise, I agree with you. That's my mom's name, by the way. Shout out. And I agree with you. That is definitely a question that my patients ask a lot as well. What I always like to answer, and whether or not you want to say something like this, what I usually say is just, it's true. There's not much research out there. There's limited evidence as to it doing anything good for our teeth. But if someone likes to do it, I say that's fine as long as they're not replacing brushing and flossing with oil pulling, right? Swishing with, whether it's oil or mouthwash or swishing with anything, nothing is going to replace brushing and flossing. So that's what I just make sure is clear to the patient. And then as far as any pros and cons to it, I do have a video you can look up if you want. Just search oil pulling teeth talk girl and it'll pop up on YouTube right away. I give all the cons, the things that can happen, right? Like like there's different things. If you inhale it, or it can hurt your jaw if you already have TMJ issues because you're swishing for so long. The limited research we have on oil pulling is all based off of about 20 minutes of swishing. So that's a long time to swish anything, right? So just keep that in mind. But my comprehensive video on that, hopefully it'll help you. You can check it out on YouTube. See what else we got. Okay, I hope that helped. North Carolina, I got so I got so distracted because over here, what am I seeing? Oh yeah, I got questions. Okay, so interestingly enough, I have my, whatever, you all don't care, but I have questions like loading on my computer screen behind my phone. Like, I think it's just like different timing. Okay, so I see more questions. So I'm gonna read the questions from over here because I could read you all better instead of like scrolling here. Anyway, so we got North Carolina. What do we say? What's your preferred toothpaste? This person is Nanya. That's their name, Nanya. Hello, Nanya. My favorite toothpaste, my preferred toothpaste is anything with fluoride. Fluoride is proven to be safe and effective on teeth and effective in preventing tooth decay and cavities. So as long as I prefer it to be ADA approved with the American Dental Association seal of acceptance on it as well. And then I'm all about using the toothpaste. I don't think you need anything fancy, you know, unless you want to do something fancy, right? Just plain old cavity prevention toothpaste is all you need. All that extra whitening and stuff, like you can if that's what you're looking for, but all we really need toothpaste is to prevent cavities. If you have sensitivity, look for the sensitivity ingredients, but in all, ADA approved with fluoride. That's what I prefer. Let's see what else we got. Electric versus manual toothbrush. Al's Ghost. That's a name. Al's Ghost. You scare me. Okay, so electric versus manual. No matter whether you're using electric or a manual toothbrush, as long as you're using it properly, you're using the correct motions with your toothbrush, they both are effective in cleaning teeth. Can be effective in cleaning your teeth at home. However, where this issue comes in is the air, like there's more chance of user error with a regular toothbrush because you have to do like a lot of motions because it's a regular toothbrush. You're supposed to use gentle circles, angle the toothbrush 45 degrees, up toward the gums on the top, down toward the gums on the bottom. There's a high chance of user error with regular toothbrushes. That's why I, as a dental hygienist, tend to recommend electric toothbrushes to almost all my patients because they do the work for you. That's really the main reason why, right? They do the work for you. And there's less chance of user error. Having said that, if you are very good, diligent, you use proper technique, you are sure you are brushing properly with a regular toothbrush and you prefer a regular toothbrush, then that's fine. You could hear me like lisping with my Invisalign, but we're doing good. We're good. We're doing okay. So that's my best answer to that is use whichever one you prefer because the one you like is the one you're going to use for the full 2 minutes twice each day, right? But make sure you're using it correctly. And if you're not sure if you're using it correctly, of course, I have tutorial videos on my website, teethtalker.com, as well as on my YouTube channel here. You can search any topic with my name next to it. So like how to correctly use a toothbrush or something. And Teeth Talk Girl after it, type that in, and YouTube will find my video on that. So I have one for electric, one for regular. Hope that helps. Someone's in California. I love it. California. My dream, that's Benjamin. Scotland, that's amazing. Thank you. Okay, Melanie's Dollhouse. What school do I have to go to learn dental hygiene? So to become a dental hygienist in the United States, there's a few different options, but the most common two options, there's an associate degree, so this is college, or a bachelor's degree. This is college. So you need to do your years of high school, and then if you want to do your associate's degree in dental hygiene, it's technically, fun fact, it's associate degree, singular, and bachelor's degree with like the, just fun fact. I always try to say it right because that's the right way to say it, but I know it doesn't matter. Anyway, 2 years associate usually requires about 2 years of prerequisite courses prior to being accepted into the 2-year program. So it's usually going to take you about 3 to 4 years anyway. The pro for the associate degree is that the associate degree is going to be more affordable, less expensive, however you want to say it, because most associate degrees are community colleges. So the associate degree in dental hygiene is an option. If you want to do the bachelor's degree in dental hygiene, that'll be 4 years, of course, a 4-year bachelor's degree. No matter what, no matter you do the associate route or the bachelor's degree route, no matter which route you take, if you're working clinically, chairside in the op, cleaning teeth, there's no like salary difference, right? So you'll be getting the same amount of money. What the bachelor's degree does for you is it just opens more opportunities. Sorry, I'm just, one second. Thank you. This is getting so dry. The bachelor's degree opens more opportunities. So if you're someone who is maybe interested in doing something other than clinical chairside in the op, cleaning teeth, maybe you're interested in teaching, like education, academia, research, sales, business, there's so many different avenues you could take as a non-clinical hygienist, then maybe consider the bachelor's degree. But if you're sure you want to clean teeth and you want to be the traditional dental hygienist that most of us know about, the associate degree is perfect. So I actually had a bachelor's degree first. in biology. I did my 4-year bachelor degree, and then I got an associate in dental hygiene after, because I was like, I don't need 2 bachelor's degrees. You know what I mean? So there's a lot of different routes you can take. Do you have to do that? What I did? No, not at all. You could do the associate degree. You could do the bachelor degree. You could do a bachelor's in something else and then the associate in dental hygiene. There are accelerated programs as well. You can look into those. They're more rare. I have a friend that did an accelerated program, and she's an amazing hygienist. So there's a lot of different opportunities. Just check in your area. I do have a roadmap, an RDH roadmap. Sorry, I'm like really losing my voice. I said it's so humid out. I don't know why I'm... Anyway, I have a RDH video checklist and RDH roadmap. I have a lot of RDH resources that can help you kind of determine what kind of journey you want to take if you're interested in the dental hygiene career. You can just find them. The easiest way to find them is on my website, teethtalkgirl.com/RDH, registered dental hygienist. So, and if you forget what I just said, no worries. Go to any of my videos, how to become a dental hygienist, Teeth Talk Girl. Again, just search that in YouTube and one of my videos will pop up, and I have my RDH video checklist and like all of my pinned comments, all of my bottom bars information. So you'll find it one way or another. And I really hope it helps you. I really, really am proud of the video checklist and the RDH roadmap that we have on the Teeth Talk Girl website, because it's a lot to navigate. Someone just said, speaking of that, Benjamin said, thoughts on going into nursing versus dental hygiene. I just filmed a video on this. I didn't post it yet. So I'm in the editing process right now. I literally was just doing the editing process today. So nursing versus dental hygiene, lots of similarities, lots of differences. Stay tuned for that video. It's probably coming out next month by the time I get it all done. There's a lot of nuanced, like, differences, but then there's a lot of similarities. It's a very similar schooling career situation, dental hygiene and nursing. But once you get into the workplace, that's where it's different, because there's such different workplace environments. So I do, until that video comes out though, I do have an article on my website, nursing versus dental hygiene. So if you type in nursing versus dental hygiene, Teeth Talk Girl on Google, that article will pop up and it'll give you everything I'm basically saying in the video. The video might have a little more information, so stay tuned for that as well, but I hope that helps. Someone's in Michigan. Hello. You are with me in the Midwest. Like the new hair, Whitney. Thank you. You know what though? It's very big today and I don't know what's happening, and I probably should have spent more time fixing it before I did this live thing, but here we are. We're all friends. It is what it is, right? Okay. Oh, hello, Potsy. Look at the amazing tooth next to Potsy. Okay, everyone. I don't know if you saw it, but there's a beautiful blue tooth next to Potsy's name. How much longer do you have with my Invisalign, my clear cut? So I think I was supposed to be done with the top in August, and the bottom, it seems like early October, which is fine. I don't mind having the bottom on. It's the top that's more annoying because that's where you get the lisp with your tongue. However, this is something I should do. I can't decide if I want to do refinement on the top. I'll just take them out. I wasn't planning on doing this, but hold on. Okay, I took the top out. Okay, if you can see, I like them. They're good. The top looks straight. However, do you see this, like, this gap? And that's fine. Gaps are fine. But I do have a little bit of a gap in between those two front teeth. I don't know if you could see it that well. Well, you'll see tomorrow when Debbie is cleaning my teeth. My Tuesday video tomorrow is me getting my teeth cleaned, and it's like a close-up of my mouth. So you'll see the little gap. I have to decide. Am I okay with just this gap forever? Am I okay with that? It's not that noticeable. Or do I want to refine it? Excuse me, I would do some IPR. They would like shave down in between the teeth so then they could push together a little more if I don't want that little gap. What should I all do? You should all help me decide, because I see both sides. I'm like, they're like, fine. They're basically perfect. Like, it's a nice smile, but is that going to bother me? So my point is, if I want to do the refinement, it's probably going to be like a lot longer, but it's fine. The bottom's going to be until October anyway. So like, if it is a couple more months, you all let me know. Should I leave them how they are in the top? Or should I do one more step? You only see it if I do that to get rid of that little dot. I would love to know everyone's opinion. I'm going to read all these comments after this, because maybe I'll just literally count how many of you think I should. I'm just so undecided. Like, oh, I'm so undecided. So let me know what you think. Okay. Let's see. Okay. Oh, people are saying no one sees it except me. That makes me feel better. People are saying don't. Oh, some people say just do it. Uh-oh, I'm literally, someone said do a poll. Can I do a poll in this? Oh my gosh, I can. Okay, thank you. Okay, I'm gonna do it. Someone's calling someone else. Okay, let me see this. I'm gonna do a poll. This is amazing. Should, uh-oh, is anything happening? What should I ask? Are my teeth okay? What should I even ask? I don't know what to ask. Are my top teeth done, or should I get them even more fixed? Wow, well, with that question, you would never know I have a degree in communication. It's like, are my top teeth done, or should I get them even more fixed with Invisalign? Even more straightened. I'm just going to say straightened because I'm like, so my brain is thinking if someone pops into this right now, they're going to see this and not know what I'm talking about. I think that's why I'm like having a brain fart. I think keep them how they are. Change them if you want. Start poll. I don't know. I just did it. Who knows? I just did a poll. If anyone, thank you to whoever told me to do that. That was such a nice, oh, people are doing it. People are voting. Thank you. Okay, so yeah, let me know. Everyone saw my little gap. Okay, someone's there. As the poll's happening, I'm going to answer more questions. I ask more questions. True. Here it is, a Q&A, and I'm asking you all questions. Sorry to make you work. Okay, I'll answer some questions. Thoughts on nano-hydroxyapatite. So, tricks. Thank you for asking. That's a great video topic. I'm actually working on a script right now. Fluoride toothpaste versus nano-hydroxyapatite toothpaste. So I am getting all the dirty deets of both, right? No. So I'll have a really good video for you soon once I finish my reading, and I'm reading as much literature as I can about both, right? But I will say, as a dental hygienist, what I tell my patients, and from what I've read thus far, I haven't written the script yet, I'm all about fluoride toothpaste. It's proven to be safe and effective on preventing cavities, right? And strengthening and remineralizing your enamel. Now, it's affordable. It's approved by the American Dental Association, as well as like the CDC and the WHO, the World Health Organization. Like all throughout all the studies, we all agree fluoride is good for your teeth. Now, I understand there's a lot of controversy going on in social media specifically, but not even social media. There's always just controversy, right? And I don't want to get too much into it because I'll never stop talking here and I want to answer more questions. But basically, I think people forget that fluoride is naturally found in earth, and the whole fluoride is toxic thing is, false. It's not toxic. Everything is toxic at a certain dose. And, if you eat the whole tube of toothpaste within 30 minutes, yes, you'll get a tummy ache. Yes, for a child, it would be toxic, right? It's the same thing with shampoo. You shouldn't be eating your shampoo. Or let's think of a better example that's closer to your mouth, like chapstick, right? You wouldn't just eat the chapstick, right? So basically, shout me out. Lavina, hello. Thank you. See, I read that. That's why so fluoride's my choice. Now, what do I think of nano-hydroxyapatite? From what I've read, the studies look promising. There's very limited studies on nano-hydroxyapatite being an alternative to fluoride, right? Do I think it's a great option for someone who refuses to use fluoride? Yes. However, all the studies that we read about nano-hydroxyapatite, the concentration that's in most of the toothpastes that are being sold right now is not high enough as what the studies are all saying. So I don't remember exact, I'd have to look, but I believe it's 10% that you need in toothpaste. Say that. I'm just kind of making up numbers, but it might be right. Say you need 10% nano-hydroxyapatite for it to be effective. All the toothpaste that seem to have nano-hydroxyapatite in them have like 5%. So yes, it would be great at 10, but I haven't seen many toothpastes with 10. And maybe I've seen a couple, but the only studies they have are studies from their own product. You know what I mean? Which is fine. There's nothing wrong with doing studies on your own product. But when you're the one selling the product and you're the one putting out the studies, I would like to see more robust research to confirm. So my point is, if you're really, really against fluoride for whatever reason, of course, nanohydroxyapatite is the second best thing that we know of as of now. One day, will it be just as good? Maybe. But from what we've seen thus far, it doesn't remineralize as well. It doesn't rebuild or strengthen tooth enamel as well. It does a lot of great things, but that's the one thing it doesn't do as good. So, or as well, or as good, or whatever you want to say. My point is, I don't know. I hope that answered your question. I knew I was going to get too excited and talk about too many things, so I tried to wrap that down into one. Really stay tuned for my video. I'm really excited. I'm going to have it all the details all in one video to make sure. But I think that basically answers. It's good. Nanohydroxyapatite seems just as good, but not as good because there's not as many studies proving it. There's been decades of studies of fluoride and not much. So like we know the good, the bad, we know everything there is about fluoride that we can't, whereas it's been like not as long that we've done research on nano. Let's see what else we got. Whoa, someone gave me a colorful thing. Oh, orange. Hello. Thank you, Al. Or AI. You never know. If so, right? I don't know. I'm thinking it's Al, though. Hello, Al. What's the quickest method to whiten my teeth? I have a wedding in 2 weeks, and I'd like to brighten my smile. That is a great question. I'm going to press heart. Hello. Where'd that go? Sorry. Okay, sorry. So what's the quickest method to whiten your teeth? So honestly, in-office whitening. So the quickest way to whiten teeth is to go to your dentist, go to your dental office. Don't go to the little mall kiosk. Don't go to the mall and find a kiosk. Make sure it's a dental professional that's offering the whitening. And ask them, can I have in-office whitening, the 1 hour whitening? You know, there's a bunch of different brands. Different dental offices use different brands. I do have a video on YouTube showing one of them, and it's a 1 hour whitening. So you get white teeth in one session. I mean, from not white at all to very white. I don't show my teeth getting whitened in it because I've never done it, but I show the result, or I'm showing the process, not the results. So you can check that video out if you want of mine, just like white teeth, fast teeth talk girl. But yeah, in-office whitening is the fastest way, and I hope that helps you. I'm all about, what am I all about? I'm all about white strips, custom trays. However, if you have a wedding in 2 weeks, maybe you won't get the results you want in those 2 weeks, right? So maybe the in-office whitening. But if you have 2 weeks, you can try every single day to use the strips. You know what I mean? My best advice is to ask your dentist because everyone's different. Everyone's enamel is different. You know how thick and thin it is. So ask your dentist, but that's what I would tell my patients. Want to try the 1 hour whitening, or if you have 2 weeks, maybe you can do like the white strips, because you have 2 weeks that you might get pretty good results. Depends on the box. Some of them take a whole month. You know, some white strips will take 4 weeks to get good results, but some might happen in 2 weeks. So just check. There's so many different whitenings online. I do have a list of some of my favorite whitenings on my website, whitening products that you can buy at home. YouTube.com/Teeth Talk. That's where we all are right now. Oh gosh, I'm playing with my hair. I just don't know how to handle this big hair right now. TeethTalkGirl.com. And then there's like a drop down list, whitening. I have a whole list of my favorite whitening products. So hopefully that'll help you if you want to try it at home. If not, ask your dentist. Wasab asked thoughts on water flossers. I love a water flosser. I think it's the best thing ever for those with gum issues. If you have gingivitis, gum disease, puffy, swollen gums, pregnancy gingivitis, you know, if for some reason your gums are bleeding and red, a water flosser might be your best friend. Someone just gave me, thank you. Resburgu. Thank you, Resburgo. That was really nice. Thank you so much. I see him over here. It's like the super chats and the stickers. Thank you so much, everyone who's using the super chats and stickers. And I think there's also like down here, you can press heart. Thank you for everyone who's pressing heart. Thank you to, what was I just answering? Oh, water flosser. Oh, goodness, I get distracted. Okay, so water flossers are great. Because they really are great at stimulating the gum tissue, right? So if you have gum disease, like I just said, any kind of gum situations. The one time I don't love a water flosser is if you're very cavity prone. Can you use one? Yes. Does it replace traditional string floss? In my opinion, no. Some studies may say differently, right? But overall, if you get cavities, especially if you get cavities between your teeth, you want to use floss. If you don't like using traditional string floss, the floss picks can help. Just something to get that little contact area where the two teeth meet. You want, that popping motion. You want to make sure something's disrupting the plaque in that area between your teeth. I love people who do a water flosser and a floss pick combo. Oh, if you're using both, A+, right? I hope that answers. Okay, let me read that. There's just so many. Thank you. Now that I said press the heart, I see so many hearts and it's giving me so many hearts in my heart. Thank you. Okay. Let's see what else we got. Ooh, there's questions coming in. Potsy, that's lovely. Would you rather have crooked white teeth or yellow straight teeth? Yellow straight teeth, hands down. White teeth do not equal health, right? Just because your teeth are white, people be whitening. They're whitening. But maybe they have rampant tooth decay in the molars, right? Or maybe someone just has naturally thick enamel, so their teeth tend to stay whiter, but they have full out gum disease, right? So crooked teeth can be fixed. What was it now? I was really just thinking white versus yellow teeth. I prefer yellow teeth because they can always be fixed. White teeth doesn't mean nothing, right? There might be a lot more. You can always whiten yellow teeth, but if you have beautiful white teeth but rampant decay and you need to pull all your teeth, you know what I mean? But the other thing was crooked teeth or straight teeth. Well, of course, everyone wants straight teeth. Oh, because you put the yellow and the straight together. I see what's happening. But crooked teeth, you know what I mean? Like, true, it's doable. You could straighten them. You could get orthodontics. You can get clear aligners like I have right now. There's so many great ways to straighten teeth, but once teeth start getting tooth decay, once you start getting gum disease, it's a lot more difficult. Okay, that was a very good question. But the white versus yellow, y'all got my my point across for that one. Okay. Oh, they're coming so fast. Every time I'm reading one, there's like so many. Hold on, I'm trying to hold on so I can read one. Thank you so much for asking these questions. Someone keeps saying, OMG, the tooth fairy's real. Is that me? Is that funny for me to think it's me? A lot of hygienists, we like to call ourselves the tooth fairy. I always think, Toothless, the movie. Wait, is that what it's called? Toothless? The movie with, I can't think of her name. The lady from Cheers. The lady from Cheers. Someone tell me. I'm about to just look her up. Well, I always think it's not going to make sense unless you guys understand. Kirstie Alley. Thank you. Toothless. The movie. I always think thank you. Shade Fire. You knew it. I love it. So yes, I always think ooh, if I do die or go to limbo or whatever it is, I hope I get to be the tooth fairy. Anyone seen that movie? Do you even know what I'm saying? Okay, someone just asked a lot of whitening questions. I'm seeing best toothpaste for whitening, Sahana. I also see how to get rid of yellow teeth, IDRK. Okay. White teeth, again, does not equal healthy teeth. Always make sure your teeth are healthy before you consider whitening. That's my best advice. You always want a professional teeth cleaning at the dental office before you whiten, because if you put whitening strip over plaque or over tartar, you're not only wasting your time, but you're wasting your money, right? Because the whitening strips won't penetrate. They won't be as effective to your enamel if you have a layer of plaque on your teeth, right? You want to remove the plaque first, get it removed by a dentist or a dental hygienist, and then you want to whiten, and whichever choice you prefer. The thing about whitening toothpastes is that whitening toothpaste, they're not going to whiten your teeth, but they're going to prevent stains from forming, which will help your teeth appear whiter, right? They're a bit abrasive. A lot of people on social media have been tagging me on this video of a dentist saying negatively talking about all whitening toothpaste. I do agree to an extent. However, I don't think it's like that big of a deal to be like making a big dramatic deal about it. Maybe in the future it will be again, but I would say if you like whitening toothpaste and that's the toothpaste you want to use it. I use it every so often, right? Can it be a little abrasive? Yes. So if you have enamel, if you have any kind of concern with your enamel, ask your dental provider before you use whitening toothpaste. But again, it's not going to whiten. It's just going to make your teeth appear brighter. Keisha's birthday. Happy birthday. That was really fun. Thank you for being here on your birthday. Happy birthday to you. Oh, I love it. I used to work at where did I work? At a restaurant in high school. And if it was someone's birthday, we did not do like, when the servers go up to your table and sing happy birthday, we didn't do it at the restaurant. And then I remember like being sad because I would have loved doing that. I would have loved being like, happy birthday to you, So I did it right now too. Thank you. Someone else just said their birthday's in 10 days or 11 days. Happy birthday. Okay. So someone just said, is it unhealthy to purposely make a gap between your teeth? Regina. I mean, it depends. There's, I don't know exactly. Like I don't know how would you do that? You know what I mean? If it naturally happens as we age, our teeth tend to shift, right? It's like a thing. So that's why we recommend always wearing your night guard at night or your retainer at night to keep if you ever had braces or Invisalign or anything, you want to keep your teeth where they need to be, right? Because they're going to shift. So if they're naturally shifting, the reason we don't like gaps is usually because, honestly, there's nothing wrong with the gap. It's what else has happened with around, right? Did two other teeth overlap causing a gap, or did you know what I mean? What's going on? Because overlapping teeth or teeth that are all on top of each other, they're harder to clean, right? They could cause a lot of issues. There's a list of issues from crooked teeth. It's not just cosmetic. I do have a video. I think you could probably search. This one might be hard. Most of them are very easy to search, but this one's something like, I don't know, something like braces, teeth talk girl. I should find it. I'll find it while I'm talking. But it's something like, are braces worth it? And they are. It's not just cosmetic. If you want to search that video, I'm going to find it for you. Maybe not. Maybe I won't. Braces, teeth talk girl. It's one of mine. You'll see it. But basically, there's a lot more to straight teeth than just cosmetics. I hope that helps. Okay, Edvin, Slick, how do you treat early periodontal disease? So I did just make a video too. It's called, if you have gum disease, do this. And that video, does anyone else like pull pieces of hair? Just like, I hate when there's like a piece of hair, it like bugs me, right? Okay, so, oh my goodness, I literally forgot what I was just saying. What? It was someone, you were a nice person who just asked me this. Oh, periodontal disease. The first stage of periodontal disease, before you have full out gum disease, right? It starts as gingivitis, red, swollen, bleeding gums. If you have red, swollen, bleeding gums, if your gums bleed when you floss, it's not normal, right? But it's still usually reversible if you don't. Thank you. Early periodontal, I know I lost my hair, lost my train of thought. It's reversible when it's early enough, right? And so it's crucial, it's critical to do everything you can to reverse it so you don't get full out periodontal disease with bone loss and tooth loss, right? Bone is what holds your teeth. And so when you get bone loss, it leads to tooth loss. So we really want to make sure that we're keeping our teeth truly as clean as we can at home and always going routinely to our dental appointments to get professional cleanings. So oftentimes when you have like a difficult case of gingivitis or you build up a lot of plaque and tartar, they might have you come get teeth cleanings at your dental office more frequently, right? So every 3 months, every 4 months, instead of every 6 months, you want to manage that plaque bacteria on your teeth and you want to make sure you get as much off as you can as often as you can. It takes 24 to 48 hours to 72. It depends. Let's just say 24. 24 hours for plaque to turn into tartar. So technically, if you skip one night of brushing or flossing, that plaque could start turning into tartar, and tartar is what creates bad things, makes periodontal disease worse. So keep them as clean as you can. Check out that video of mine. If you have gum disease, do this. Teeth Talk Girl, you can type that and it'll pop up and it'll give you all the best home care routines that you can do. I just saw something. Oh, Mahir Patel is asking, is sugar bad for teeth? You know, fun fact about sugar, I always say it's not the sugar that no, I don't say this, but some people, they like to do like a quick, what do they call that when they get you in? Clickbait. When they do a clickbait, they're like, sugar doesn't cause cavities. And it's always like, and it makes you watch more. And then they go, it's not the sugar. It's the sugar, but it's not the sugar that's causing cavities. It's the bacteria in your mouth eating the sugar and pooping out, which is true. But I don't know why that bothers me so much. It's like, I think it's just like false advertising when people are like, sugar doesn't cause cavities. But it's the sugar that the bacteria in your mouth are eating. They munch on the sugar and then they secrete, however you want to say it. They poop acids on your teeth. And yes, it's the acids that cause the cavities. However, if the sugar wasn't there, the bacteria wouldn't be doing all that. You know what I'm saying? So yes, sugar is bad for dental health because it leads to an increased risk of cavities. If you're keeping your teeth nice and clean, sorry, I don't know where I'm sitting here. If you keep your teeth nice and clean, it helps to reduce the sugar from sitting on your teeth and helps reduce the amount of sugar being eaten by all the bacteria that's on your teeth. Bacteria is naturally hanging out there. That's, a thing. It's fine. We have good and bad bacteria, but you just don't want those sugar bugs to literally poop on your teeth. The poop is the acids, and the poop is what's going to give you cavities. Someone said, you a gamer? No, I'm not. However, I used to edit all day my videos, and I'm at this computer all day, and this is an ergonomic chair. Ergonomics, right? Like, it's got so many good. So no, I just bought a gamer chair because it was good for my back and my neck. Okay, I'm gonna do a few more. This is so exciting. I love it. Thank you all also for just like hanging out with me. This is so exciting to talk teeth. I do feel like we're all friends here, whether you are a subscriber to me or not. If you just came across this right now and you're like, oh, dental health YouTuber, interesting. Thank you for being here. Like, how cool that the internet can bring us together to discuss dental health, I love hanging with you all. This is really nice. As I say that, let me look at these pictures over here. People talking about my chair. Thank you. It's fun. It's my studio chair. I film all my videos there. Okay. Amanda Davis. I need to know about getting a root canal. Okay. What can I tell you? If you need a root canal, someone said I'm a secret gamer. I wish. What did I used to play? You know what I used to play on PS2? I'll tell you about the root canal in just a second. Sorry. PS2, I used to play Rayman, anyone? Please tell me there's one person in here that knows that game. I was a Rayman player. I loved Rayman. You're making me want to bring out my PS2 tonight. Your grad party game said you were a gamer. Zach Westerhoff. Whoa, big spender. What? Why did you give that much money? Okay, thank you. Your grad party games, thank you. I don't get that. My grad party said I was a gamer? Your grad party game. Oh my gosh. Wow, y'all. Am I a gamer? I think I said I'm not. I need to look into that. That's so funny. Raymond rocked. Thank you, Anthony Lycan. You know Raymond. Woo! Okay, root canals. See, we're having fun. We're talking teeth. We're going back and forth. Zach Westerhoff is not my husband. He's my brother-in-law. But that's, someone just said that. Karima, that's funny. Thank you. But Alex Westerhoff is the husband. But we all work on Teeth Talk here together, the three of us. So that's why I was laughing because, like, let's see here. That was very nice to do that. But I'm laughing because I can't stop thinking about Raymond, that game now. Okay, root canals, important information. So there's also, I am going to do a video on this soon too, because root canals are very controversial and they shouldn't be. There's no reason, as with anything. So yes, if you need a root canal, get a root canal. Having your tooth in your mouth be saved is the best thing you can do, right? You always want your own body parts in a sense, right? If you can't save the tooth with a root canal, if your dentist, endodontist, whoever in the dental field, your dental provider tells you, oh, it's not looking good that we're going to be able to do a root canal. It's just, we're probably going to have to pull the tooth and give you an implant. Perfect. I mean, an implant is the best way to replace a missing tooth. But if you need to try and save your tooth with a root canal, it's the best thing you can do. You want your own tooth in your mouth. After a root canal, especially if it's a molar, you're most likely going to need to get a crown too, because, they took out all the stuff with the tooth. So you need to put a crown on top of it to make it nice and strong and continue to live in your mouth. The only reason, I don't even know if you're just asking to ask, or if you're wondering about the misinformation online. A lot of times there's a lot of misinformation with root canals because I think people get confused. So the reason you do a root canal is because there's an infection in your tooth. What they do, I don't know, this is your root canal, or your tooth. There you go, this is your tooth. So if there's an infection in there, they go in the root, and they clean out the infection. That's what the root canal treatment is. They're cleaning it out. They're making it nice and clean. They're taking out the nerve. They're taking out everything. And then they clean it out really good, and then they cap it. Where the misinformation comes in is if it's not cleaned out properly. Right? Like with any surgery you get in your body, a heart surgery, if your heart surgery isn't done properly, it could cause you problems, right? If you get a pacemaker put in and it's not put in properly, you know what I mean? So I think that's where the disconnect happened. And a lot of people, but it's very rare for that to ever happen. And if you're going to an endodontist, a root canal specialist, someone who has specialized their entire life on doing root canals all day, you are in perfect hands. If you go to a dentist that does root canals with microscopes and they take it seriously and they take their time, you're going to be fine. So don't worry about it. Root canals are also, when I was an assistant before a hygienist, I was a dental assistant. Someone asked about that. I was a root canal assistant for a while, right? So I assisted on root canals. Don't worry, you're going to be fine. Most of my patients were like bored, right? Because you're just like laying there. There's not much going on. It's a quieter appointment because there's not much drilling. There's a little bit of drilling at the beginning, but you know what I mean? You'll be good. I had 3 roots in one. It hurt a lot, but it's better. So that's the thing. If your tooth is hurting, the root canal treatment is what's going to remove the hurt because it's removing the infection. So you're going to feel better after the root canal. It's going to make your tooth feel better. So you're going to be good. And if you want to watch any of my root canal videos, I have a bunch of I have informational ones. I have the procedure itself if you want to watch it. Some people love watching the procedure because it reduces their anxiety, but others, they don't want to watch the procedure till after they have it done because they're curious what happened, but they don't want, you know what I mean? So you best. But yeah, just type in root canal teeth talk girl and you'll find all my root canal videos, whether you do it on Google or on YouTube. So you're going to be great. And DM me on Instagram at teeth talk girl. I'd love to know how it goes too. Like, let me know. You know what I mean? So I try to go through as many DMs as I can every day, and I would love to hear how it goes. I'm sure you're going to do great. Someone asked me, is it better to be a dental assistant first before studying dental hygiene? Okay, when? That's a great question. So it depends on where you live, where you plan to go to dental hygiene school. In general, no, you don't need to be an assistant before hygienist. They're like 2 completely different jobs. Is it nice to know like the tooth numbers and just like how the office flows in a dental office, like as a dental assistant before you go to dental hygiene school? Sure, it is great to know like a few things here or there, but being a dental assistant first will not make you a better hygienist. It just might make you more comfortable once you go into the workplace, but I wouldn't say you have any advantages in school. However, having said that, there are more and more schools, dental hygiene schools, that have a point system, and you get like more points. I don't know. I didn't do it, so this is just hearsay, really. But there's point systems where if you have more points, you're more likely, admissions to get in and stuff like that. I have more information about this on my RDH roadmap that I was talking about earlier, teethtalkgirl.com/RDH. But basically, check the admissions requirements for the dental hygiene school you're interested in. If the admissions requirements say dental assisting is a plus, good to know. If it doesn't list it anywhere, then don't even worry about it. You know what I'm saying? I hope that kind of answered. Someone just said, how long will my fillings last? Jenkins. I hope I didn't miss any others. I think because I have this opened in 2 screens, I'm like all over the place. Okay, how long will my fillings last? It just depends, of course. Fillings, I mean, it would be lovely if they last a lifetime, right? Every filling is different. Every tooth is different. I will say that, remember the old school silver amalgam fillings, this is just personal. I'm just saying what I've noticed in my life as working as a clinical hygienist. I've noticed more amalgam fillings kind of breaking down sooner, just leaky. They had to be done right to last a long time. So having said that, if they're done right, they can last a long time. However, what if you had a filling on your top teeth and you tend to grind your teeth? There might be self-induced ways that are causing them to not last as long. So there's so many variables, but take care of them best you can. Ask your dentist how long. When you get a filling, ask them how long do you think this will last, and they'll be able to tell you individually how long your fillings will last for your mouth. Okay. Hi, I'm new here. Are you a dentist? I'm not a dentist. I'm a registered dental hygienist, and I am I am a doctoral student in health science. I'm going to start. Should I start saying that in my opening of my videos? I always go, hi, my name's Whitney and I'm a dental hygienist. Should I start saying, hi, my name's Whitney and I'm a dental hygienist and I'm a doctoral student in health science? I feel like I should start saying that because I think it's good to know. I've dedicated so much of my life to academics and academia, right? And I feel like that's a good thing to know, that I'm constantly doing school stuff. Okay. There's Zach again, the husband/boy, or no, what is he? No, I almost said husband/boyfriend, but I meant to say husband/brother-in-law. He said no. I think I'm going to do it now. Okay, okay, hold on. Someone asked me, I just held it. It was such a good question. Before I go, someone said, thanks for the reply. You're so welcome. Someone says, does getting a cavity filling hurt? It shouldn't hurt. You should be numb. They'll numb you up with local anesthetic. And if you're feeling anything, raise your hand, let them know so they can give you more. Okay. Okay. Where's the question? Someone had it was something about something. Is flossing necessary? That was it. Grim Reaper. Is flossing necessary? So for most people, yes. But for others, some people benefit more from water flossers, interdental brushes, floss picks, different type of cleaning between your teeth methods. It is necessary to clean between your teeth. However, some people either can't, dexterity issues, there's different, so always ask your dental provider what they think is best for your individual mouth. I do have a video called Flossing Alternatives. You could search it again, Flossing Alternatives, Teeth Talk Girl, type it in, and you'll see my video that kind of it gives you a generalized view of all the different flossing options, but you need to clean between your teeth with something, because when you brush, you're only cleaning 60% of your tooth. So 60% of your teeth, that means you're missing 40%. So 40% is a lot to not clean between your teeth. You need to clean between your teeth with something. 40% is huge. Someone just asked, are you a student? I just finished my master's degree and now I'm about to start my doctorate degree, but I'm not a dental hygiene student. I've been a dental hygienist for almost 10 years now. It's 9 years this year. So next year's 10 years. So I've been a dental hygienist, but I've just been furthering and advancing my career in academia. Max, hello, thank you. What nitrous is like and what do the masks look like? Oh, I wish I had one in here to show you. If that's what you're asking, the nitrous masks. So nitrous is also known as laughing gas. You may have seen it in a lot of movies or TV shows when they put the little thing, they put it over your nose. They don't put it over your mouth because we're working on your mouth, right? So they put it over your nose and you breathe through your nose, in and out, and it's nitrous oxide. So you're getting some oxygen and some nitrogen, the whole thing. And makes you like, it takes the edge off, makes you loopy. Everyone acts kind of differently on it. Some people will just get really sleepy. Some people are relaxed. I've never had anyone say anything wild. It's nothing like when you get your wisdom teeth out. You've seen videos of people talking kind of silly after their wisdom teeth, like saying weird things. It's nothing to that extent. Nitrous is a lot more conservative of an approach to making you relaxed, right? Once you turn the nitrous off, ooh, I just snapped with my left hand. I never do that. Once you turn the nitrous off, give it like 3 to 4 minutes, you're fine to go drive home. Nitrous is not getting up in there like the heavier Twilight general anesthesia stuff, nothing like that. So yeah, nitrous is great if you have a little bit of dental anxiety, a little fear, a little nerves at the dentist. You can always ask if they have it. Some offices will have you pay extra for it. Some won't. I feel like most will have you pay a little bit extra, but some people swear by it. Like I've had a few patients. I try to avoid doing nitrous. I just don't. I think my philosophy is like, I want to keep you calm. Let's talk. Let's communicate. You know what I mean? But there are some patients that are like, Whitney, I need it. And that's fine. If you need it, ask for it. And it can really relax you. What was I going to say here? And you could use it for kids as well. Yes. Someone asks, do you have Invisalign? Yes, I do. I do. When I post this later, I can't believe I took these off live, but I took them off earlier because I was asking everyone, I don't know, is that pole still there? Oh yeah, keep them how they are. All right, I'll do it one more time before we go because I have like 3 more minutes. So there's like a little gap in between my 2 front teeth, and I can't decide. The top are done. These are as straight as they're going to get. And I feel like they're pretty straight. The bottom aren't done yet. They're going to need more time. This is just kind of a retainer holding them in place because you have to do a retainer for a while after. Anyway, and I have that little thing there still too, the little button. So I was asking everyone earlier, should I do a realign? Like, should I get them even straighter because I don't want that little gap? Or am I the only one who notices it and it's not a big deal? So that's what the poll's all about. In case you wanted to know, tomorrow I get my teeth cleaned by Debbie on my full-length video, my full-length Tuesday video. I do full-length videos every Tuesday and Thursday, dental health topics. I try to read all the comments on all the videos. Thank you all for always giving me video ideas, asking questions to make more and more videos and doing more lives like this. Someone just asked, Rich V, what are your thoughts on using xylitol gum? Is it legit and worth it? I love xylitol gum. There's like one study that came out recently, like saying xylitol is bad or something. You got to be careful. Don't ever just read, what am I saying? Don't ever just read a title without reading the whole article. Sometimes even if you just read the conclusion, it's not going to give you what you need. You need to read the methods. You need to understand what they did in that research. So my point is, don't worry. Don't worry about the xylitol being bad as long as you're not like consuming a bunch of it every day. If you're using xylitol gum, you're chewing it, you're fine. What was I going to say? Oh, xylitol is great because it naturally repels and like inhibits bacteria. So it helps reduce plaque in your mouth. It actually helps make your mouth more pH neutral. And like we were saying earlier, an acidic mouth, acids in your mouth is what causes cavities. So xylitol can help prevent cavities. Can it remineralize teeth? No, it can't as far as we know thus far, but it can help repel plaque. So I love toothpaste with fluoride, but if it's fluoride plus xylitol, even better, right? So I'm not using one with both right now in it, but whenever I come across those, I love that. No, xylitol's great. Thank you for doing these lives, Whitney. Thank you for coming. Thank you to everyone who's in Europe too, like Patsy, like it is so late where you are. Thank you for being here. I keep saying it, and I know I haven't done it yet. I need to do one of these lives in the morning. Maybe I'll do like a Saturday morning or something. So then everyone who's in Europe doesn't have to stay up till like 2 a.m. because, I don't know. I'll ask in the community section in YouTube and like see what time and day works best for everyone for the next one. I'm trying to do more and more lives this summer before I start my doctorate program because like I don't know how like busy I'm gonna be. So I want to like do more and more here. Someone said we didn't get to see the slobber. I did that on purpose. I wanted you to see my slobber. Let's see what else I got. Okay, got 5 more minutes. We got 5 more minutes. Someone said can't wait for the video tomorrow. Me too. I can't wait for you to see me get my teeth cleaned. We had so much fun. We were cracking up. Good night, almost 2 a.m. here. Peace, love, and teeth, Potsy. Thank you so much for being here. Joe Meehan said almost 3 a.m. Why? Someone said, why do I skip a ton of questions? I don't know. I'm sorry. Tell me your question. I didn't mean to skip it. There's just so much happening. Jeffrey, let me know your question. Someone said, what brand toothpaste? You know, it's more about the ingredients than the brand, and it's more about, in my opinion, if it's ADA approved, right? Approved by the American Dental Association, then you know it's been tested for safety and efficacy with toothpaste. So I hope that helps you. Let's see. I like how someone said, like, if you want, change it. It's expensive. You might as well be picky. You're right. You're right. That's such a good way of thinking. Okay. Oh no, it got like frozen. Is that a sign that I should be done? I don't want to be done. We still have 3 minutes. I could do one more question. Okay. This is like our quiet time while it gets unfrozen. I want to answer one more question before we go. One more question. Okay. Someone said, this is fine. This is great. Look, a great ending question. Is it wise? This is Da Vinci. Is it wise to get a second opinion or even a third? Yes. If you are concerned about what your healthcare professional is telling you to do, you feel uncertain about it, of course, if you don't trust them fully, always get a second or third opinion. I would say that across the board on healthcare, right? There are slightly nuanced different philosophies that every person may take, right? Some dentists are more conservative, some are more liberal in the sense of some may want to do the smallest filling they can and leave as much tooth structure there for you as they can, because natural tooth structure is best. I see that side, but I also see the side of some dentists. If you have a cavity, they want to get rid of as much decay as possible. I mean, you always want to get rid of all the decay, but I think I'm trying to explain this the best way is that some dentists will be like, I'm going to go big or go home. This way, I'm going to do the whole tooth right now. We're going to maybe crown it and then you'll never have to touch it again. I understand that too. If it's like right on the edge of like needing a crown or a big filling, you know what I mean? So there might be very slight little differences. And if you're uncomfortable with what your dentist is proposing for you to do, you can always go to another dentist and ask. So I hope that helped answer your last question. Someone just said, do you have patients or do you work on YouTube and TikTok? I have patients. I do work clinically chairside and off cleaning teeth. I love it so much, but I love being here as well. Thank you so much. Someone just said, is there a place to email questions? My questions was missed. Please come to the next live and also DM me on Instagram at Teeth Talk Girl, and I'll help answer as many more questions as I can. Thank you so much for being here. Oh my gosh, I'm seeing all the questions now. Oh, I still have 1 minute left. Someone just asked, how do you feel about veneers? I do have a video all about veneers versus crowns. You could type that and find my video on YouTube. If you have any specific video topics that you wonder if I ever answered a question about them, just type in the video topic plus my name, Teeth Talk Girl. So say you want to know about wisdom teeth, Teeth Talk Girl. Whether it's on Google or, whether it's on Google, I'm like hiccuping now. Whether it's on Google or YouTube, my video will pop up. And if you still can't find an answer, please DM me on Instagram at Teeth Talk Girl. And I can't wait to do this again. I'll see you all next month because I'm planning to do this all the time. So I'll see you in 4 weeks. Thank you so much for being here. Peace, love, and teeth, and happy Monday night. I'll see you next time. Ooh.